Hi students, I'm going to go through your second PowerPoint for Chapter 4, Introduction to the Patient Record. Learning objectives. Go ahead and just read through all these learning objectives that you are going to be able to do by the end of this chapter. So you're going to be able to summarize the multiple uses of healthcare data. You're going to be able to describe the categories of data collected and maintained by healthcare providers. Identify provider responsibilities for the patient record. Distinguish between authorship and authentication of the patient health record, define acceptable authentication methods, and then we're going to be able to distinguish between abbreviations allowed, not allowed in the patient record. We're going to be able to use the correct process for when you have to amend it, illustrate the flow of patient information from admission to discharge, distinguish among patient record formats. We're also going to look at that primary and secondary sources, summarize record retention, alternate storage methods, and patient record completion. Provider documentation responsibility. Okay, the Joint Commission, they state that only authorized individuals may make entries in the medical record. So keep that in mind, whether it be a doctor, nurse, physical therapist, occupational therapist. Your hospital is going to have who can authorize in that patient record. AHIMA recommends that anyone documenting in the health record should be credentialed or have the authority right to document as defined by the organization's policy. Every individual must be trained, they should be competent in the fundamental documentation practices of the organization, and then the legal documentation standards. All writers should be trained in, follow their organization standards and policies for documentation. One thing to remember, authentication rules are published by the CMS, which is the Centers for Medicare and Medicaid Services. Okay, so what does the provider documentation responsibilities all entail? Signatures, counter signatures, initial, we have fax signatures, electronic, rubber stamp signatures, abbreviations, legibility, timeliness, and amending. One thing that I love to say over and over, if it wasn't documented, it wasn't done. So if a provider performs a service but doesn't document it, the patient or third-party payer can refuse to pay for that service. So let's just say that a patient came in and the doctor documented that they went ahead and manipulated the ankle. Let's say they broke the ankle, manipulated the bones back together. So they didn't document it. So this charge goes in and it comes back, and then the third party payer says, we don't see that you manipulate it. We're not going to pay for manipulation. So at that point, if the insurance isn't paying it, the patient should be responsible for paying it if it wasn't documented. So who's going to have to pay for it? It's going to have to be the hospital itself. Missing documentation can result in problems if the record needs to be admitted as evidence in court of law. So let's go ahead and look at discussion activity 1. Let's do some thinking here. Physician sees a patient for a medical procedure and an x-ray. Physician tries to bill for both the medical procedure and the x-ray. However, forgot to document the medical procedure. Can the insurance company refuse to pay for the medical procedure if it isn't documented? Take a couple thoughts here. Think about it. Why or why not? Hey, yes, the insurance company can definitely pay for the medical procedure because there's no proof that it was done. And the patient will not have to pay for it because, once again, there's no proof it was done. So the hospital at that point is going to, or the physician, is going to have to write it off. Authentication. All patient records require authentication, which means an entry is signed by the author. Federal regulations published by the CMS specifies that the only author of an entry can authenticate that entry, establishing that that entry is accurate and has been verified by the author. Now, auto authentication, this involves a provider authenticating a dictated report prior to transcription. This is not consistent with proper authentication procedures because providers must authenticate the document after it was transcribed. In addition to transcription, many providers use speech recognition software, also known as voice recognition software. They use this to dictate reports and progress notes. Everybody should be aware what this is. I mean, I'm sure a lot of people do this already in their phones, and you can really see why this needs to be looked at, because I know a lot of times when I dictate into my phone, the words get jumbled and they don't interpret exactly what I'm saying. Countersigning. The facility must require that providers sign with their first initial, last name, and then their title or discipline. Countersigning an entry must be qualified. So a countersignature is a form of authentication by an individual in addition to the signature by the original author of an entry. So the federal guidelines for hospitals require medical staff to identify types of document non-physicians may complete, as well as entries that require countersignature by a supervisor. So your Joint Commission standard also addresses countersignatures. It states that a hospital must define the types of entries in the medical record made by independent practitioners that require countersigning. Okay, telephone and voice orders. Countersignatures required when a nurse or any other authorized personnel, pharmacist, they document a telephone order taken from a physician. So that order is a verbal order taken by the telephone, and then they have to sign it. Same thing with the voice order. Okay, different signatures. You have a signature legend. This matches initials used by must be included on the same form or on a separate signature legend. A document maintained by the Health Information Department to identify the author by full signature when initials are used to authenticate the entries. Then also some fax signatures, they can be accepted by facilities, electronic signatures also, and signature stamps. These can be accepted, but it has to be for the use in the facility. The providers whose signature the stamp represents must sign a statement that they are the only one that's going to be using the stamp. Can't give it to the nurse to go ahead and utilize that stamp. Hey, abbreviations. Every healthcare facility should have a policy to their abbreviations and what those abbreviations going to stand for. So one thing, the facility should maintain an official abbreviation list. Timeliness of a patient record entries. This is really important. So a couple of different things. You want it signed as soon as possible. One thing to remember that Medicare conditions of participation require that a physical exam to be performed no more than 30 days prior to admission or 24 hours after admission. The Joint Commission requires patient records to be completed 30 days after that patient's discharged. That time they can become delinquent records, and then you would have to calculate the delinquent record rate. You would divide the total number of delinquent records by the total number of discharges in that period. Okay, addendum. How do I do an addendum? I kind of talked about this in the first one, but document the word addendum, clarification, or late entry, depending on circumstances at the beginning of a new entry. You want to document the current date and time as the date and time of the original entry as a reference. You want to authenticate the addendum, State the reason that you are doing the addendum and provide any supporting information that provides clarification. Enter the current date and time. Do not try to make it appear as the entry was made on a previous date or a different time. So a physician needs to make an amendment to the patient records and ask their nurse to do it. Can the nurse make this amendment on their behalf? Why or why not? Take a second to think about it. Pause the lecture. So you come back. This is what it is. A physician needs to make their own amendment. A nurse cannot do it. Okay, patient falls out of their medical bed, breaks their hip. The nurse documents the incident report in the patient's medical record, providing all the details surrounding the fall. Did the nurse document this incident report correctly? Think about that. Okay, no, she did not, or he did not. The nurse did not do this correctly. You make just a note saying that dated patient had a fall. Documentation does not go into the patient's record, it goes into administration. That sums up lecture number 2.